welcome to Physician Spotlights. My name is Dr. Carolyn Newberry, and I'll be serving as your host today. I'm here with Dr. Ajay Jain, who serves as the Section Chief for Pediatric Nutrition, a Professor of Pediatrics Pharmacology and Physiology, and the Associate Division Chief of Pediatric Gastroenterology at St. Louis University. I'm very excited to speak with him today about his experience in nutrition during this Physician Spotlight. Thank you for joining us.
Well, thank you for having me.
I wanted to first start out by just asking if you could tell us a little bit about yourself.
So I have been serving as the section chief for pediatric nutrition for some time, and I have been working in the field of nutrition for almost more than 2 decades. So this is very keen to my heart. Specifically, I have been looking from a clinical perspective the various nutritional problems that children face, which I can detail more. Very heartbreaking and very fulfilling if you can help some of those patients. And from a research perspective, we are trying to look at novel strategies to help mitigate injury and side effects in short bowel syndrome that a lot of babies as well as patients from all ages suffer as they go on parenteral nutrition for prolonged periods of time.
Right. And it's always so interesting to talk to people that have been in the field for such a long period of time. And I love to get back to, when you really thought nutrition was going to become a part of your career, because it helps a lot of us more junior faculty understand, how this process begins.
Hey, Helen, I think it goes back when I was in med school. We were rotating through the pediatric ICU, and you would see these small babies, really hapless babies who had gastroschisis, a condition, as you know, where the GI tract is not developed, and a lot of that is exposed to the surroundings. And those babies, and there were a lot of kids with a condition called necrotizing enterocolitis. So these babies would not be able to eat by mouth, and they would go on TPN. And a lot of them will undergo bowel resection, which is so disheartening. And in some ways, the parenteral nutrition was providing support for them to live, but we also knew that a lot of these babies had the liver injury progress as they stayed on parenteral nutrition. And I would then follow them up as a medical student, eager and run around and see where these patients are going. And a lot of them would then come up in liver transplant clinics. And while transplant, is a sort of a very humbling process where you're sort of giving life out of a tragedy, so livers are coming from somewhere. These patients suffered a lot. And I, at that time, thought that I really wanted to help this group of patients and help how we can improve this nutritional therapy, for the betterment of the entire population.
Right. So, it sounds like your interest, of course, dates back to the time in your medical training. I'd love to hear about how that interest evolved over time and what your first position looked like in the nutrition space.
Yeah, thanks. Obviously, I was this was sort of very near and dear to me during med school. And I decided partly at that time to do a pediatric residency. And I thought I will, like to follow these patients. And then as I was doing my residency, you get more exposed to cholestatic liver disease, the nutritional deficiencies that these babies get, the fatty, acid, the fat malabsorption, and a whole host of other problems. And that led me to do pediatric gastroenterology and hepatology and nutrition. It's a combined fellowship at Texas Children's. It's a very large program. It's a very large transplant center. So we also had a lot of such patients who would have both bowel and a liver transplant, and would clinically care for them, which was very satisfying. But there was a lot of morbidity, and these patients went through a lot of suffering. And that's the time when I said I wanted to find ways how we can help these babies. And I looked around and I researched, and I found some labs which were looking at injury prevention in short bowel syndrome. And that's when I found a mentor who also agreed to mentee me in this role. And I think that relationship has evolved over the past 2 decades. I still am thankful to them, Dr. Byrne and David Moore, and they have really helped me build my career. And we have now a nice NIH-funded lab, and we look at gut to systemic signaling in a very novel short bowel model, and we are looking at injury prevention strategies both through luminal signaling as well as some intravenous therapeutics.
That's great, and I think it really ties nicely into a lot of the questions that we end up asking our physician leaders, and that is, the importance of mentorship, and sort of if there are people that you've identified during your career that serve as mentors. So I'd love to hear more about that relationship and how important that has been for shaping your career.
I think mentorship is key for any junior faculty as they develop their research or even clinical career. I think, we have to have people who have gone through the process, who are willing to share their experiences. And, what I've also seen, a good mentor, really guides you the way to do things, and not necessarily, is, on your shoulder saying, hey, do this, do that. So they really enable you to do things. I had some fantastic mentors, Dr. Byrne at the Baylor College of Medicine, David Moore, as well as a whole bunch of people at the Children's Nutrition Research Center there. I think it was key because I would go to them, for research questions, understand research methodologies, understand what is possible, understand the limitations, which is very important, and understand one very key factor, that research is brutal. Most of the things will not work, and don't give up. I mean, that's what research is all about, because if you knew the answer, then why do research? But a lot of things that you think will work will not work. But the key is be persistent, never give up, and keep on writing, keep on trying to you find answers, keep on questioning, and it's a fun thing because as scientists, our goal is to question and then find answers, and this is sort of the best medium to do it.
Yeah, absolutely. And I think that's resonated with a lot of the people that we've spoken with during these interviews. I'd also like to hear more what you think, the biggest limitation to physicians who are interested in nutrition is, and maybe some ideas of how we can start overcoming these problems.
So I think one of the biggest problems is, I think over the last decade, the healthcare model has changed substantially. For physicians, there is a lot of emphasis on, the term RVUs, generate more RVUs, and payer mix and collections. And what ends up happening is that physicians are sort of comfortable doing clinical practice, and they don't have the dedicated time to do research. So I find a lot of people who say, hey, I have this phenomenal question, but I don't know how to answer that because I don't have the time to do it. So I think that's one of the biggest limitations, because I still talk to a lot of fellows and med students and junior faculty, and even mid-level faculty who have ideas, but they don't have the time to be able to do that. So I think if we can generate, from institutions as a priority that research is important for any academic center. I mean, that's the reason why, new drugs are developed. That's the way new techniques are developed. That's the way new surgeries are developed. We need to be sure that we are protecting our people, the junior faculty, through seed grants, through support funds to be able to do research, and providing them with mentorship and the tools to be able to do that. And I think once we are able to do that, I think this will change. But I think that's one of the biggest limitations at this moment I foresee ongoing, which is going to prevent a whole bunch of people who are nevertheless very interested in doing nutrition research but are unable to do so.
Right. And that resonates with me as a junior faculty member, and sort of finding that time to answer those questions, and also to be involved in nutrition, even clinical work, because a lot of times it doesn't pay the RVUs the same way that, the procedures that we perform. As I'm a gastroenterologist as well in adults, and, we definitely feel that limitation. I'd also love to hear a little more about how ASPEN has shaped your career and how you've utilized the organization to help with mentorship, research opportunities, et cetera?
Well, I owe a lot to Aspen. In fact, when I was a struggling young researcher, I applied for a lot of grants, and Aspen, before I got my NIH grants or almost any grant, I think Aspen was my first extramural funding that I got through the Rhoads Foundation. So I am, with all my heart, thankful to Aspen, because I think Aspen really built my research niche. As you know, in academic centers, the real challenge is converting the intramural seed grants into extramural funding. So I owe a lot to Aspen. I think they were the first one. I got the seed funding through the Rhoads Foundation, and that really snowballed into more foundation grants, support through NIH. We now have a robust R01 funded NIH R01 funded lab, and I cannot thank Aspen. Aspen has also helped me grow from a clinical perspective. I think it has a lot of resources to help people understand the nutritional needs of the community. The Malnutrition Awareness Week is fantastic. Some of these podcasts that you guys do, I have been listening throughout my career, and I think it helps you evolve as you develop in your nutrition career.
Yeah, absolutely. And that's also great to hear for the organization. So I think we're wrapping up soon the interview, and thank you so much for spending this time with us. I didn't know if there was anything else you wanted to add to the conversation or anything else you'd want to tell listeners of this interview.
The one thing which I would like to say is that for junior people, and I'm not specifically saying for physicians, I know, it's Aspen is it's a multidisciplinary organization. When you look at, dietitians and pharmacists and nurses and surgeons and physicians, for all of them, I have one message for the junior faculty. If you have an idea, do not let go of it, because sometimes ideas, especially at a junior level, you may think, hey, maybe I'm too young and maybe this is not such a good idea. You may be surprised. Some of the best ideas actually come from the junior people, not people who have been doing this like me for 2 decades, because we've already worked on our ideas, we've already developed those, but the new spark comes from the new blood. So never give up that idea that you get. And then, if you are persistent, you will find a way to get your stuff done. I can bet on that. I started as a 100% clinician. It's an odd trajectory, but I started as a 100% clinician, before I got any of the grants to support the work. But what I learned from my mentors was never give up. Keep on doing. If you have an idea and you're passionate about it, things will open up. So my message is, if you have a burning desire to do something, and that actually holds for anything, whether that's research or clinical medicine, or you want to be a phenomenal nutritional clinician. If you want to do it, have the fire in belly, things will happen.
That's, I think, a very nice thing to end on. So thank you so much for joining us today. And this was another monthly Physician Spotlight interview. And we look forward to seeing you next month. Thank you.
Likewise. Thank you very much for having me here.